my name is Remedios Rico, and I'm the dental hygienist provider here at Midtown SNAHC. And today we're going to be talking about how to floss. So first, let's start off why flossing is important. Flossing helps to scrub bad bacteria, plaque, and food debris that can start causing some damage if left alone. Flossing has a major role in our dental hygiene routine because it helps prevent cavities and periodontal disease. Periodontal disease involves such as gingivitis, which is gum inflammation, and periodontitis, which involves a little bit more so bone loss. Now let's go into the different types of floss. The cool thing is that there's many different types and varieties that best suits you. This is string floss. This is best used when used properly, and it reaches into the sulcus. This is the gold standard of care, and this is what we all love in the dental field. Next up, we have the floss picks. This is the most common type that I feel people feel more comfortable with. This one's great if used the right way. This one may cause some blunting, but it's really good for dexterity for those who have trouble reaching in the back molars. Next up, we have Super Floss. Super Floss, it comes with a little threader, and this is for people that have more so bridges. This is so you can get underneath there and it's not as harsh on your gums. This also helps with orthodontics. So those who have braces, this is going to be very, very good for you because it'll help get underneath the bracket and actually into the sulcus, not just leave stuff hanging around. And next up, we have our interdental brush. This interdental brush, it comes in many different shapes and sizes. It kind of looks like a little Christmas tree. As so. This one helps also with ortho. It helps with wider spaces, such as that comes along with periodontal disease. So this, you just got to use very gently. And last but not least, we have our water pick. Everybody likes to ask about the water pick. Does it work? Yes, but it doesn't replace string flossing. String flossing, again, that is everyone's favorite. That's going to get it all out. But this is going to help with orthodontics, spaces, and it also helps flush out any little gunk stuff that's laying around after your regular flossing. You could do this 2 to 3 times a week, but make sure to stick to your string floss. And what I mean with orthodontics is braces. Those are fun. These things are good with kids. Again, it's a 4-way stream, so it's going to get into the sulcus, it's going to get around those brackets and get all those little yucky stuff out. So these are just some common types of floss that you can use, or interdental aids. Use what best suits you. So now we're going to be going over a quick demonstration of how to properly floss. So first you want to make sure you have 12 to 18 inches of floss. This is going to give you the adequate amount to get throughout your whole mouth. You want to make sure you wrap it around each middle finger like so. You're going to use your index fingers as a guide and your thumbs as a guide. First, you want to go in between. Make sure you're not jamming it in there. That'll cause some blunting. You want to make sure you're hugging the side of the tooth. This is called the modified C-shake method. And you want to make sure you're getting into the sulcus in an up and down motion. You don't want to seesaw. That's going to start causing some damage. So again, up and down. And then as you can see, I'm going to come up, string it around, and then you want to go on the other side of the gum. You see how there's a V shape? So you want to make sure you're going on each side. In there, and then in so. Again, use your fingers to help you as a guide. Again, for those floss pick users, you want to make sure you're not shoving this into the gum, okay? That's going to cause some blunting. You want to make sure you're gliding right next to the tooth in an up and down motion and making sure you're not going directly on. Again, you want to go on to both sides. Make sure you rinse this off underwater. You don't want that bacteria to be transferred from tooth to tooth. Next up, we have the water pick. This is really cool because it has a 4-way stream. It's going to help massage the gums. Make sure to have it at a low setting to start off with because it can get quite messy. You want to make sure you're running it right along the gum line and right in between the teeth. Again, this shouldn't be rushed. You want to make sure you're getting it right into the sulcus. And for those braces users, you also want to kind of angle it around that bracket. What are some common misconceptions that people think when flossing? Well, a lot of people say, well, my gums bleed or it hurts my gums. Well, think of it like this. When you have a splinter in your skin, it's going to continue to be irritated until you get it out. Same with your gums. There's that bad bacteria, bad debris causing some damage, causing some irritation, and it's going to get better over time. You just have to be consistent. Consistency is key when it comes to flossing to help keep that bad yucky stuff out and help your gums heal. So again, flossing is best done at night because that's when bacteria tends to grow. But if you need to do it in the morning, you do it in the morning or in the midday, as long as it's getting done. And hugging motions towards your teeth, not seesawing. Again, better teeth, better health.